This is a plan made by the big ass Negro himself.
Bruv, don't go and show people.
I'm not going to show anyone, don't worry, but you can tell. This is memories from my BSc. You can tell he's getting a bit pregnant. Can you turn around, please, Abdi?
Bruv, check it. What are you talking about? Check it, bruv. Check it.
Turn to the side, Abdi.
Huh?
Give us a side view. Alright, let's just look at that wedge black house. Why are you turning away quickly?
Why?
Alright, let's look at the plan. This is done by the Don Abdi himself. Calcium metabolism, hypocalcemia, hypercalcemia. You got causes, symptoms, investigations, treatments, and you got the intro. And with the intro, first of all, you start with the function. The function, you've got the structural function, which is in bone. You've got neuromuscular, which is... Bro, I can't read it right. What's going on? Neuromuscular, which is in the nerves.
Action potential.
Action potential. So enzymatic. What's the enzymatic action?
So enzymes need calcium. Enzyme activity depends on calcium.
Okay. Then you've got signaling.
Cellular signaling.
Cellular signaling. Okay, that needs calcium. That's calcium dependent. Then you've got membrane permeability. That's also calcium dependent.
Yep, action potential.
Action potentials again. Okay, brilliant. Then you go on to the calcium in the body.
Majority is found in bone.
99% of the body calcium is found in the bone. It's needed for bone remodeling. Osteoclast, the way to remember it, according to Muhammad Abdi himself, is cluster bomb. So that breaks bone. So osteoclasts are the ones that break bones. Osteoblasts are for bone formation. ALP, which is also made by the liver.
It's also made by the bone. Is an important enzyme.
Yeah.
For formation of the osteoblast.
So for formation
of bone by the osteoblast.
So when someone breaks their bone and it's remodeling, your ALP levels are raised.
Yeah.
True? Okay, then you go into calcium in the plasma. 50% of the plasma calcium.
So the rest, so 99% we said is in the bone.
Yeah.
So that 1% is found in the plasma.
Okay.
From that 1%, 50% is bound.
50% is bound to albumin.
And mainly, which is a main protein called albumin.
Okay.
Albumin is
produced by the liver.
protein with the liver. Yeah. However, we should take into account, so the rest is ionized, free calcium.
Okay.
We should note that the affected levels of calcium can be affected by pH. Reason being is albumin is normally bound by the hydrogen ions. Yeah. In alkalosis in blood, so you've got low levels of H+, so you need more H+. So what happened, the body compensate by telling albumin to dissociate H+, to release H+, to try and increase the levels of H+ in the in your plasma.
So basically,
so what happens, albumin remains free bound, so hence ionized calcium from the blood has to compensate by binding there for it to be released. So what happens in alkalosis, you're more like you get hypocalcemia because the calcium in the blood goes and bounds from the H+.
Brilliant, Dr. Abdi. Let's go on to the measurements of calcium.
So symptoms of patients who've got anxiety problem, hyperventilation problem, tend to get hypocalcemic symptoms.
Okay.
Yeah? Yeah?
Brilliant.
Sorry, what? Yeah? The last one is, so as we've spoken about majority of calcium, we need to know, how do we then measure calcium? We measure calcium two ways. We can measure them total calcium. What do you mean by total calcium? Total calcium means calcium that is in the plasma, yeah, that is free calcium, and the bound calcium. So both the free calcium and bound calcium are, we can measure it as total calcium. But the problem is this a true and a good sensitive marker of calcium level in your blood? No, because if you've got low albumin,
for example, in liver disease,
you'll have low albumin, so hence you'll have low bound calcium. So it's not going to be a significant amount of calcium, the same as someone who's got normal albumin levels.
Therefore,
understand?
You go to...
Yeah. So there's a new method that's been produced called adjusted calcium, where they look at the albumin levels and they adjust your calcium levels according to the amount of albumin. Yeah? So this is a new method that the laboratory use to measure calcium.
And it's more accurate.
As it's more accurate.
Okay.
Now we'll talk about regulation of calcium. So how do we control calcium? What are the hormones that control calcium? 3 hormones. 1, PTH. Yeah? 2, D. 3, calcitonin.
Is VT a hormone?
Yes.
Calcitonin. Okay.
Yeah. So PTH.
Parathyroid hormone.
Who produces PTH? Parathyroid hormone. What is the parathyroid hormone? Yeah. As you know, that they're found next to the above the thyroid gland.
Okay.
Yeah. They tend to secrete parathyroid hormones, and they secrete parathyroid hormone when the calcium levels are low. So what do they cause? So they are secreted when hormones of calcium are low.
Levels of calcium.
Yeah, levels of calcium are low. So what is the action of PTH? PTH action is, what they do is in two levels. Is they act on the kidney, 1, and 2, they act on the bone. Yeah? What do they do in the kidney? They cause reabsorption. This is important. This is very important. Reabsorption of calcium in the kidney, yeah? Yep. And excretion of phosphate.
Why excretion of phosphate, Dr. Abdi?
This is how they work. This is why in PTH, a sign of symptoms, if you want to find out a patient who's got high calcium and low phosphate, you will tend to find that they've got low PTH. High PTH. High PTH. So what happens is, that's what they do. They act on the PTH receptors in the kidney to cause calcium reabsorption and excretion of phosphate.
Why excretion of phosphate?
It's a countercurrent mechanism that they act on.
Okay, brilliant.
Yeah? So this is the levels of this, that you need to remember that fact. Yeah? So that's important. The other thing is, what they do is they also stimulate calcitonin, but in a less extent.
So the PTH stimulates calcitonin?
Yeah.
Okay. Now, what are the PTH effects on the bone? So
the PTH effects on the bone is, what they do is they cause release of calcium within the bone. So they increase activity of osteoclast. Remember?
Osteoclast, cluster bones, break bone.
So when you break bone, calcium is released. So increase calcium to increase calcium in bone. So we can see that these hormones are released when there's low calcium in your blood.
Okay, let's move on to vitamin D.
Vitamin D now. So how does vitamin D work in controlling calcium? As you know, that vitamin D, we need to know about vitamin D, is normally firstly hydroxylated in the liver. Yeah? And then hydroxylation goes further to other hydroxylation that undertakes in the kidney. So first liver, and then they get hydroxylated further to the kidney. Yeah? Okay. Which then becomes vitamin D.
Okay.
Yeah? Yeah? Do you understand that?
Yeah.
So what does he call? The vitamin D do three things. One, they act on so vitamin D, let's go here. Yeah? What they do is, it's important that they act on the gut, yeah, bone, and kidney. Yeah? What do they do in the gut? The gut, they synthesize calcium binding protein.
What does calcium binding protein do?
Yeah? This calcium binding protein helps in calcium and phosphate absorption. Yeah?
Okay.
So you absorb more calcium and phosphate absorption.
Okay. Does that
so
work?
You can see here the difference is in vitamin D. This is important. How you can differentiate between vitamin D. They cause phosphate absorption.
Whereas PTH,
they cause phosphate excretion. Do you see that?
Mm.
So in people with hypercalcemia due to PTH, they will have high level of calcium but
low level of phosphate.
Good.
However, when it's hypercalcemia
due to vitamin D, they'll have
high levels.
Both calcium and phosphate high.
Okay, brilliant.
Do you understand that?
I do indeed.
And the second thing is, at the bone, what do? They stimulate bone resorption. So breaking down bone. Bone resorption, yeah?
Yeah.
So to
so
release
again,
more.
it's osteoclast.
Yeah?
Osteoclast